Hi, I'm Aiden Overton. I'm a student nurse here at the University of South Alabama, and I'm here to perform my medication administration checkoff today. I've got my student ID, Aiden Overton. I'm going to scan the room. And I would start by being in an interruption-free zone. According to hospital policy, I would not take any phone calls. I'd limit conversations to only extremely important ones, and I'd make sure the door to the medication room is closed. I'm now going to compare the patient care order form to the MAR. I see we have Jaguar J. Jones, medical record number 417-6352, 417-6352, an allergy to penicillin, We've got morphine sulfate, 5 milligrams, IM, every 4 hours, PRN for pain. That meets all elements of a legal prescription. I'm now done with the patient care order form. So I'm going to set that off to the side and just use my MAR from here on out. I'm going to perform hand hygiene. And now I'm going to start the first check of the 7 rights. First, we got name, Jaguar J. Jones. We've got morphine sulfate, we got expiration date 12/20/2025, 2026, its end date. We've got 10 milligrams per milliliter, and on the order it says 5 milligrams. So we do 5 milligrams is 0.5 milliliters. And it is IM, intramuscular. So we'd use a 3 milliliter syringe, a 23 gauge 1-inch needle, and a blunt plastic cannula. So what I'm going to do is get my alcohol swab, and I'm going to clean the top in a circular motion, not going back over areas I already have before. I am now going to get my 3 milliliter syringe and my blunt plastic cannula. I'm going to peel both back and screw on. I'm now going to dispose of the wrappers and the garbage. I'm going to draw up 0.5 milliliters of air to match the amount of morphine we need. Remove the cap. Push that air in. Okay. Going to put my hand behind my back and cap. And show you that I have 0.5 milliliters. All right, and since we have our morphine, 5 milligrams, which is 0.5 milliliters, IM, it's every 4 hours. It's been more than 4 hours. PRN for pain, and he is in pain. And this completes all elements of a legal prescription. Before we go any further, I'm going to get my sharps container. I'm going to remove my blunt plastic cannula. Over here, get this back, screw this on, put that in the garbage, and that's going to complete our first check. For our second check, which will now begin now, we have Jaguar J. Jones. We have morphine sulfate, both in the vial and in the syringe. We've got 5 milligrams, which is 0.5 milliliters. We have IM, which is the right syringe and needle for it. Every 4 hours, it's been more than 4 hours. PRN for pain, and the patient is in pain. And this completes all elements of a legal prescription. I will now make our label, which will include the patient's name, the medication, and the dose. So we've got Jaguar J. Jones, morphine, 5 milligrams per 0.5 milliliters. I'm going to put this on my cap. So we've got Jaguar J. Jones, morphine, 5 milligrams per 0.5 milliliters. And this is going to complete the second check. So I would perform hand hygiene. I would gather my syringe and needle, my morphine, and alcohol swab, goggles and gloves. So I would knock on the patient's door. Mr. Jones, how you doing today? I would raise his bed up to a working height and lower the side rail. I'm going to be giving you some morphine today for your pain. So I'm going to do the third check. So we've got, move this into frame for you. We've got Jaguar J. Jones. We've got Jaguar J. Jones. Medical record number 4176352. 4176352. Allergy to penicillin. Do you have any other allergies, Mr. Jones? Nope. Cool. So now I'm going to compare. We've got morphine, sulfate, both in the vial and in the syringe. We got 5 milligrams, which is 0.5 milliliters. We've got IM, intramuscular. We've got the right syringe and needle. Every 4 hours. It has been over 4 hours. PRN for pain, and you're in some pain. Okay. And that meets all elements of a legal prescription. I'd also check vitals, do a pain assessment, blood pressure, heart rate, respiratory rate, see how that pain's affecting him. So I'm now going to perform hand hygiene. Put on my gloves. And my goggles. This is an IM injection, so I'm going to be doing your ventrogluteal area, your hip. I'd put my palm on your greater trochanter, my pointer finger on your anterior superior iliac spine, and my middle finger stretched out towards your iliac crest, and to go right in the middle. So I'm going to get this alcohol swab. And I'm going to start in the middle, go in a circular motion. Not going back here as I already have. I'm going to have this pointing towards the injection site. I'm going to remove my cap. And since it's IM, I'm going to stretch the skin, insert at a 90-degree angle, little pinch, aspirate for blood. No blood, so we're good. Put this down for pressure. Throw my needle in my sharps. All right. I'm now going to remove my gloves. And my goggles. Perform hand hygiene. I'm going to go put this information in the MAR in the computer. I will be back in 15 to 30 minutes to assess if you've had any allergic reactions or any side effects. Do you need anything before I go? No? All right, that's gonna do it for the medication administration checkoff. Before, I'm going to lower the bed to the lowest height and raise the side rail. Thank you.